Recording. Okay. Well,
should we open that window a little bit in case it gets hot? ولی سر صدا میاد. نه.
let's record.
Okay.
What's up?
What's up?
So we've been meaning to do this recording forever.
Yeah.
We're here in Bend. Nilu will tell you the story. My name is Dr. Mo. I'm a family medicine doctor, currently house husband. Nilu is a rheumatologist, so she's here in Bend, Oregon, on a locums position. And I kind of wanted to get your idea of what it's like now doing locums for the very first time, but also having thought about doing locums for a long time.
Yeah.
And having not seen patients for a while, while we were in our travels. So I think the last time we recorded was in Paris. So maybe
Together.
Yeah. And so I want to ask you a bunch of questions about what it's been like, just doing this locums thing, what it's like coming back, and hopefully inject as many of my own biases in there as possible.
Of course.
Took us only about an hour and a half to set up this scene that you're looking at. But it's very natural.
So I am doing a locum rheumatology position, mostly essentially your average regular rheumatologist, which is mostly outpatient. With eventually, I'm gonna get credential with the hospital and do some inpatient, but it's right now just outpatient. And I had not ever done a locum through a locum company, a Locum Tenens recruitment company, ever since 2019 or 2020, when I quit my sort of like permanent position in Southern California. I've just been word of mouth, previous position I was in, or friend of a friend going on maternity leave. So it was just basically me filling in. Yeah, cross coverage. And so I had never gone through a locum company, and I wanted to try it. So this is the first one.
And you've had a very traditional, I think, experience. You did fellowship at a good center. You came out. You worked in 2 different clinics, right? FQHCs essentially, give or take. And then you sort of quit. You stepped back. And then you traveled a lot with me when we met in 2019. And when I say travel, we just went and lived in other places.
Right.
But you didn't necessarily work full-time in one place. You didn't really do anything virtual. Then every time we would go back to LA, you'd pick up some gigs at these clinics that kept you on a roster. And you'd pick up some shifts. And at some point, you're like, this is kind of what? Like, you thought you needed something more consistent or secure, or was it because the last time we went back to LA, you couldn't actually find any opportunities?
Yeah, I guess I always thought about locum because, when I first quit that job, I was like, oh, wow, there's such a thing as locum and I can go to different places. And I always thought it's going to be really undesirable locations that nobody wants to go and work. But it turns out nowadays it's everywhere. Last year I even got locum offerings in LA, but at that time I was working somewhere else. But
USC or something.
Yeah.
We're going to try to not drop any names of anything, just so God forbid somebody tries to.
But so I did mostly kind of like some virtual internal medicine, right? Yeah. I did a little bit of that, and I did just whenever...
You dabbled in it, you wanted to see what it's like.
And then mostly,
Last year, we left and we were gone. We were in Iran, we were in Italy, we were in Canada. And so you had been away from work for how long? 8 months?
Yeah. And I mean, that wasn't even the longest. I'm trying to think, like 2020, was it 2021 was the longest, I want to say, when we went to Spain, or was it 2022? Anyways, one of these years, 2021 or 2022, 2022 was probably from February to November. We were just living in Spain. And I didn't work as a rheumatologist. I just did some telemedicine, internal medicine. But yet when I came back and let that, local position that I had always like kind of gone back to, and they had called me and they were like, we need a rheumatologist. I was like, oh, I'm in town. And they said, yeah, come and work for us. So I always went to this familiar position, and really I haven't worked more than 3 days a week at most. That was like 2 days a week I was covering there with some weekend hospital calls. And then at some point, briefly, I did 3 days a week. So I hadn't done like a full time in a while. So
then eventually you found, you called around a lot. You hooked up with a few kind of locums companies. You found one where this seemed like they communicated well with you. And finally, after putting some offers in some other positions and some other places, you found this one here in Bend, Oregon.
Yeah, because I ever since I quit my full-time job, I was sort of I think everybody nowadays gets like emails from locums all the time, right? So it's not like...
some of us don't because of past history with the medical boards. But yeah, I know what you mean. Anyway.
Yeah, but anyways, so I had always gotten offers, and last year I actually talked to them and I was like, maybe like I'll go. But then I decided to take this, I think I was always hesitant because I was like, I don't know what it's going to be like. They pay you more than, they pay you more than you would average get as a per diem, right?
Yeah.
And so I was like, the work is going to be probably brutal. And so I think I was always hesitant about that. And even this time when the previous positions that I were in LA had already gotten a full-time rheumatologist, so there was no availability. And I was also kind of just like, I don't even know if I want to go back there. But, I was like, I'm just going to give them 1 week a month availability. Or I'll do 3 months and that's it.
This is to the locums company.
The locum company, right?
And there were some opportunities. There were some you were going to jump on. And I think just for people to know, I think the ranges was somewhere around 200 to 250 or something in that range.
For rheumatology is 100. Well, for rheumatology, and please do tell me if it's the range different because I'm new to this and I don't know any other rheumatologists that are doing locum. So it might be that the reimbursement is higher. But I did talk to different locum because I like the same position. I would get called by several different locum companies and they would give different rates, right? But it's from 190 to 230.
230.
And the position that offered me 230 last year that I didn't take was a high-paced position.
So I think that was the other thing she was considering. Some of these places, they asked you to also cover the hospital. They asked you, of course, to cover in baskets, or some didn't. But then your patient volume was somewhere between 18 to 24? Am I wrong?
Well, it's interesting because when you first get the email, almost all of them says like 10 to 14, 12 to 16, But then that one position last year that was going to pay me 230 said we're 20 minute, 40 minutes, right? 20 minute follow, 40 minute new, which is kind of like average most places. And so he said, yeah, like you potentially... He didn't say any, like they didn't tell me like, oh yeah, we'll ramp you up, don't worry, or like we'll give you some blocks. He was like, well, maybe we can give you one like, blocked 20-minute or something. But it seemed to me with that position that it was going to be potentially, because they're all follow-ups that need to be seen, like a potential 24 patients of follow-ups that are all essentially new to me.
Right.
So
there was no follow-ups for you when you're doing locums, essentially, until maybe the last day when you leave.
But all the other positions I've interviewed were set maximum of 16.
Okay.
Yeah.
No.
Yeah.
No, because once you called the medical director or talked to somebody on the phone, they're like, it's going to be like 18.
Which one?
I don't remember, but I think the recruiter had told you a certain number of patients, and then when you talk to them...
No, the recruiter says, it says like 10 to 14. or like the numbers are way
So
lower.
the most you were supposed to see a day was 16?
Yeah, I think of the two positions I interviewed for last year that I didn't go with any of them, one was 16. One of them was like sort of a county, and they said
Wasn't
it
there
was,
some that were sent to you where it was more than 18? Or am I just remembering it wrong? Well, you didn't even consider probably.
yeah,
Maybe
maybe
not,
I didn't
maybe not.
consider.
And so I think another important thing for Nilu when she was considering these locums was it had to be in like a setting she liked. So it had to be kind of a city or state somewhere where she was interested in going, if I'm right.
Preferably, but remember, we were considering like
Yeah,
some
somewhere in the
places
middle of
that like,
nowhere.
I mean, we were looking at like what it looks like. I thought, okay, I'm gonna go somewhere. I did really want to experience something different than like your big city, so I did want to see like, some places that I normally never go to, maybe closer to nature, maybe smaller cities, maybe remote. I wanted to know both what rheumatology is like in those places, and two, like what it's like to live in a completely different environment than a big metropolitan
Sure.
city.
Yeah, you definitely were interested in the adventure side of it, but you wanted to be somewhere maybe like that was pleasant to you, that you wouldn't gonna
Yeah.
feel like you're suffering, right?
Right, for sure.
And so you had a good contact at this locums company. You guys went back and forth, and then finally you agreed to this gig, which was going to be 4 days a week, right? 4 days a week, and some sort of a weird schedule where you're here for 2 months, on for 2 weeks, off for 2 weeks, on for 2 weeks, off for 2 weeks, and then you finish with two more
Two
months at
months,
the
yeah.
end. So kind of from, let's say, April till
December.
December. And you then had to start the negotiation stuff. Like,
Well, yeah. Initially, the locum company, the person that I'm working with, was like, if you're just giving 1 week a month, it's going to be really hard to get you, because most of these places actually want somebody to continuous, but they're okay to take 2 weeks a month because then somebody else, some other locum, will fill in the 2 weeks. So then I was like, okay, let's say 2 weeks a month. I'm going to offer 2 weeks a month for 6 months or 3 months continuous.
Yep.
That's what I thought. But then when I interviewed with this position, the person, the chief that I interviewed with was really nice. And she was like, we need you 2 months, and then it'll be 2 weeks a month or 6 to 8 weeks. I don't know. Somehow it's like the locum person's like, how did this happen? You were like barely going to do 2 weeks. But I agreed to the 6 to 8 weeks in the beginning, and then every 2 weeks. And then that's how it happened. Yeah.
because I think when you do a locums, there's room for negotiation, right? So they're going to cover your housing, they're going to cover your travel, and then they have a set number of patients they want you to see. They have a set number of hours they want you to work, weeks they want you to see patients. And then you were like, hey, let me negotiate a little bit, see what I can get. And
Right.
I think you negotiated for some good things. I think you got a little bit of a higher hourly wage. You found the kind of the right schedule that's good for you. But before that, before getting here, like maybe 2 months or 1 month? No. Like 2 weeks, at least 2 weeks before, you were definitely.
No, more. I mean, I accepted
What are we saying? What are
the
we trying to
job,
explain?
like that I was really anxious.
Yeah.
Right. I accepted it. So we got back to LA, or Long Beach, where we live, in January, right? Sometime in January,
January
I
8th?
think. Anyways, yeah, February? No, January, mid-January. And then January 20th, I think it was. Then I think I interviewed with one of these positions either in February or March. No, February. So I accepted the job in February. So then I had to wait to get my Oregon medical license, right?
Right.
Until, so March, and then end of April, it was going to start the job. Somehow I went into panic mode. I couldn't understand it, like literally from it wasn't reasonable necessarily. It was like, I was like, why am I just so panicked? Definitely one was that I was like, I'm going into this unknown
Yeah.
position. I haven't done rheumatology. At that point would have been like, by the time I would start would be like 8 months or something like that, maybe longer. And all of a sudden, I was super in doubt of myself. I was like, I don't know anything. Like, I've forgotten maybe things. Even though, come to think of it, like, I did go even longer and then went back to rheumatology, right? So it's not like, but I started to, and there has been a lot of new drugs that have come out in the
That was a
past
big
year
fear
or
of
two.
yours, yeah.
So I was like, just trying to frantically read, but it wasn't really necessarily helpful because when you do anything frantically, it's probably not that
Oh,
helpful.
you were studying. I forgot about
I
that.
was studying.
You were studying every day.
I was studying.
Watching lectures, Vumedi.
Yeah. And then I was also just kind of like in just panic mode and preparation mode in my head, like, how's it going to be? Where are we going to stay? And so I was like thinking about like how many patients I'm going to see and how many hours of like pre-charting I have to do to get to know the patients, how many hours of post-charting, and then the in-basket. And so I was like getting into like a panic, yeah, for a while.
So when that was happening, like what were some of your
Thinking about it now gives me anxiety.
what were some of your like tactics of like dealing with it? What were some of your outs? What were you doing?
To deal with the anxiety?
To deal with the anxiety,
Yeah.
to cope with it?
Well, I was doing several things. One was like just kind of trying to like understand why I was anxious and like, you know, write down like, okay, well, it's this. Okay, so you're really anxious about like maybe feeling like you're not good enough and like need to know more, right? Knowledge. So I was studying for that, but I was also trying to deal with it, like talk to Tom Compton, who is like sort of like my therapist. He's not a therapist, but he's my, you know, facilitator of the work of Byron Katie. And I've been working with them, and it was more like to kind of like see what is this underlying belief and like where is it coming from. So kind of dealing with the mental aspect of thing and the thoughts that are behind this anxiety. I was also trying to like talk to this Ayurvedic physician that I've been seeing for the past few years. That's been really helpful to me. And I got some supplements for anxiety. And then like it's like a mix of like, saffron and ashwagandha and things like that. But it wasn't, nothing initially was working. Like none of these things were really helping me feel better. Oh, and I also did, like at some point I had so much anxiety, I was doing tapping, right? Like I was like, you know, that's actually really helpful. Like it's kind of an immediate help with anxiety. So you get a little bit lower. And then I started to also...
You were doing the workouts with Amir Hossein from Iran.
Mm-hmm.
You maintained that.
Not in Iran, he's in France.
He's in France.
Yeah, as well, we started working out with him when we were in Europe, right? And so I would continue to work out sort of like virtually sometimes 3 times a week. But I think what...
Go.
Well, I was going to say, I also talked to like the locums, and none of this was helpful because I was like, can they give me a scribe? Or I would like email the chief and say, hey, exactly how many patients do you want me to see? Like I was like,
yeah. You were
kind of like emailing, trying to like just like see, okay, like maybe it's not going to be as bad as you
get
think.
a better feel for like, what am I really walking into?
Right.
Because you really didn't have a good feel. This is the odd part. Like we really had no clue what we're walking into. And I wonder if maybe this medical group themselves didn't really know, their department, what else is out there. So they couldn't really paint a good picture for you. It can sometimes also just be communication. But I know that you were trying to back out of it.
Right.
For a week or two before.
I considered it. I definitely considered, well, I don't know if I definitely thought about it. I was like, this is an option. As I was getting closer though, as the recruiting company paid for my like medical license, of course I was like, oh shit, like they're already paid for my medical license. And this was another thing. They weren't willing to get my housing until my medical license goes through. And that was also stressing me out because I'm like, I don't know where I'm going to be. I really like to be in an environment that is cozy and feels good to me. I didn't want to be somewhere that's just like dark or, you know, I didn't want to, it was important to me. And so I ended up just ultimately booking it myself, right? But before that, yeah, I considered it. I kind of feel like there was a turning point for me. There was a night that I had like a lot of anxiety, and then I really sat with myself and sort of like sorted it out in my head. But I don't know, maybe it wasn't just that. Maybe it was like all the work I did, maybe it was supplements I was taking, but it was like after that,
I remember you had
started
almost close to a breakdown, but you like really went into it and you like dealt with it. And I think the next morning you were like, you had some...
because like the breakdown was when I had thought, okay, I'm seeing 16 patients max. But then when I one day I talked to the chief, and she was like, yeah, so we have this in basket and you have to cover all these other people.
An infusion center.
You're covering the person that you're covering for. And then you're covering your own patients that you see, and and then you're also covering whoever else is not there on any given day. And then there's like an infusion center that you're also covering. And so then I was like, oh my God, like I was like panicking. And then she was like, well, our schedule is every 2040. So then I was like, oh my God, if it's 2040, there's no way that it's going to be 16 patients total. And so that night that I was really freaking out, I sat and wrote down like what was freaking me out. And I was like, it just kind of got really real. And I was like, okay, here are the options. You can either just say, I don't want to go, right? And whatever is the price you pay for it, essentially. Like, I think I just went to that kind of a technique of like, what's the worst thing? And I realized that the only way that I can come out of this much anxiety, I had so much anxiety about also like how I'm going to be when I am in that future position. Like I saw myself in this job being really overwhelmed, being like even like crying at work or getting bitchy or like, and I was like, I didn't want that. I was like, I do not want this Nilu. I don't want to be having people see me like that. And so I was constantly seeing myself as this overwhelmed, kind of out of control, not being able to handle it, giving a notice, whatever. And I was like, not okay with that. And on the other hand, I wasn't like 100% sure that's how it's going to be. So I didn't want to say, no, I don't want to go.
Yeah.
Right. So then I realized, okay, Neil, you're not 100% sure that it's going to be like this. Obviously, if you were 100% sure, you'd be like, I'm definitely not going. So you do want this adventure. And so you just have to accept that all of those sides of you. You just accept it. There's going to be a bitch maybe that'll come out, or a crybaby or whatever. And it was like super clear that like, yeah, that's what I have to do. Like I have to just accept those. That what's the worst thing? Yeah, I went to the worst thing. And then I was like, and it was just so amazing. It was like this, like almost like a spiritual moment of like being like, just like, I need to just accept myself. And then I feel like after that, I kind of just dropped it. Like, I feel like I was like emailing them and asking them like, how is it going to be? Am I going to have a scribe? And then I was like, well, let's just go see what it is.
As we say.
Fuck hello. Yeah. And I think I stopped having as much anxiety after that.
You also, I think, came to terms with that, but you also had your out, which was if you didn't like it within the first month, you were going to bail.
They had told me that from the beginning.
And one of your other friends had told you about it. The one who does ICU coverage.
Yeah, so the only other person I know that does locum, and if you guys know any other locum, especially rheumatologists, please let us know, because I would love to...
Comment section. Comment.
Yeah, because I would love to connect with other locum rheumatologists especially. But I have a friend who does locum pulmonology. Like, for example, she told me she doesn't accept more than 15 patients in clinic. She was like, that's my max. But she also hates clinic. She's like, I just want to do ICU. But the recruiting person, that was my point of contact, told me that you have a month and they have a month. They have to tell you,
they might let you go after a month.
You have to give a month of notice, right? But after a month, they can decide they don't want you, or they've found somebody permanent, or you can decide. But of course, then he would say like, it's never happened. So of course, then you have that pressure. I don't want to be that person. It's like, I realized so much of my anxiety was, I don't want to be that person. And once I was like, I'm okay being that person because, yeah, even though I don't want to be that person, but it's possible that I'll be that person.
So if you think back now to the first week when you got here, so we obviously drove up, right? We were figuring out how to get here. They give us a car, so we have 2 cars here in Bend. Bend is a small 100,000 population city. It's very green. It's sort of like it's for tourists, it's a destination place for skiing and mountain biking, stand-up paddle, surfing on the river.
Let's not say a lot of good things about Bend.
Bend sucks.
Bend is shit.
Bend is crap, guys. So, I mean, it's the shit, right?
It is very expensive, though. This is the truth of it. It's as expensive as LA.
Yeah.
That is the truth.
Yeah. But anyway, you got here for what was your first impression when you kind of got here to this place and we walked around a little bit, like that alone?
Well, the first impression is how green it is, right? And how there was like no traffic.
People were nice.
Like, I mean, those things, I guess the first week, we're talking about the first week, right? Yeah, I mean, when we went to the downtown, it was like so beautiful. And I was like, what a beautiful town and how peaceful. And then with the job, I just felt like everybody was really nice. Everybody's really nice. And they really want me to, I don't know why it's making me emotional. They really want me to do well. They really want me to succeed. Of course, it's like very
They had left you a little book.
Oh yeah, no, they left me a basket with like, a Bend coffee and a book about like Bend, hikes and like, just like really thoughtful, and like they did a really good job, I think, with like orientation, even though the first 2 days was like, like just really my brain was.
The electronic health record, the in basket.
I mean, so
you were worried you're not going to remember anything.
It's so true. I actually did write, even though I was like, oh my God, it's a beautiful town. Now I remember it was actually also really painful to be at work because I was like, I would come back from work and my brain was fried.
The first day your eyes, do you remember your eyes? You couldn't handle your eyes.
Yeah, it's amazing how
she couldn't keep her eyes open because it was.
And I couldn't see well. And also I realized, actually, after she taught me, she was like, just do Control Plus and everything will get bigger. I'm like, okay, yeah, I'm old. I have to accept that my eyes are just not as... but also I was learning the EMR and I was like, I was like one of these old people who was like,
how do you do this thing?
When I was in residency, first EMR came to Kaiser. I was a Kaiser resident. And I remember like one of like the old oncologists, he would like sit there and he would like the screen was here and it was like totally me. Like, and even though it's ironically, it was Epic that I trained with in residency, but Epic has changed so much. Right. And so I'm trying to learn this EMR. I wrote a note to myself that it was like, just give it a month. Like we talked about this. You were like, you have to give it a month.
Repetition.
And I was like, okay, give it a month. And I think it's gotten better, but they still haven't ramped me up to a full schedule yet. And it's almost going to be, it's been 3 weeks that we're here, right?
You got up to 12 patients, 11 patients.
12. I've gotten up to 12. I mean, once I get my own follow-ups, because 6 of those 12 or 8 of those 12 sometimes are new patients, right? But once I get my own follow-ups, it's going to be a lot easier because other people's follow-ups, I still have to read through a lot of notes and figure out what's going on. And sometimes it's harder than a new patient. But I still haven't gotten credentialed for the hospital. So we'll see when all of that happens.
Credentialing for the hospital is so that she may have to see inpatient.
Consults, inpatient. But I think it's still when I get home, it's like my days are, I get there at 8 and I work through lunch.
What time do you wake up here?
I wake up around 6:30, right? And then I get to work at 8 and then I work through lunch, going like in basket and whatnot. And then finish anywhere from 5:30 to 6:30. And when I get home, I don't feel like doing much, which is
pretty much vegging out. Once you get home, you're vegging out. right? And I think that's the tough thing about full-time work, even though it's 4 days a week, so you get one day in the middle of the week off, but you essentially just have enough. Today was your off day, and you had to schedule a bunch of chores, right? Yeah, you'd made a bunch of phone calls and tax stuff and everything. And by the time you come home at 6:30, you're dead. I think emotionally and like physically.
I just realized that like there's only so many face-to-face interactions
Yeah.
you can have with just people, right? Like aside from obviously, your partner that like that's you don't have to put up a front, or you don't have to like, kind of be on your best. You're just the way you are. But with every other person that you interact, you obviously are trying to bring your best. And so there's a level of energy. And then also, with patients, they need something from you. And so I feel like after a certain number of interactions, I've noticed it's just tiring. Especially if you're just trying to do kind of like we said, like have eye contact, listen to someone. You're not just like, okay, like you have a cold, here's an antibiotic, like it's involved.
Don't make fun of my profession.
But it's like involved. I have to listen to like head to toe.
Well, you do a lot of pre-charting,
what systemic symptoms
right?
are going on, huh?
You do a good amount of pre-charting with patients.
I don't really do a good amount of pre-charting anymore. I did it that first week, and then I realized like I spent so much time pre-charting. Some of them no-showed. They put other people on my schedule, and I'm like,
do you read about the patient before you go in?
Yeah.
So you're still doing a little bit of pre-charting?
I have to read about the patient before I go in.
You're doing it on the fly?
I'm doing it mostly on the fly. Like sometimes I do it, like today I probably did like half an hour or something of just like seeing like, okay, is there going to be like something that I need to freshen up on? Or
I think you had a couple of other good, interesting observations for the physician audience. If you're not a physician, get off the channel. I think you said that sometimes in rheumatology, you might have a practice where you're seeing mostly like bread and butter. And then sometimes you have a practice like this where you're seeing, I don't know, is it still true? Or maybe after a week or two it's changed?
I definitely feel like there's a lot of pathology, a lot of interesting pathology here than like, so like a last practice I covered was like a community practice, right? Like somebody's maternity. And so that was mostly osteoarthritis, osteoporosis, very few like
complex
sick
cases.
lupus, like very few sick lupus or myositis, that I saw. And then where I worked, which was the county, but it still was kind of community/county. I had some really sick patients, and then I still had a lot of, fibro and OA.
Here you're seeing like what kind of cases?
Although even in county, we did say we don't see primary OA and primary fibro. But here I've seen a lot of interesting cases because they're coming, it's still kind of remote in some way. It's not, it is remote, right?
It is remote. Yeah, there's no major medical centers here.
So we're in Bend, Oregon, right? And all of the vicinity, they end up coming here from 2 hours away.
Portland is probably the next major city. It's about 2.5, 3 hours away.
Right.
Yeah.
Yeah. So they're all coming to us.
Do you feel that seeing more complex cases is better, or do you kind of miss the bread and butter, like easier fibro, maybe OA?
Nobody misses fibro. That's the reality. You can't do anything for fibro, so you just, feel frustrated. But I feel like it's nice to have a balance where you see some interesting cases that are like, why I went into rheumatology, right? And it was like, especially if you can have support, if you can run it by someone. Here, like they refer the patient sometimes if it's complicated to like OHSU, which is like in Oregon and in Portland. It's nerve-wracking when somebody's really sick, for sure. But it's also interesting. It's like mentally, like it's like challenging in a good way. If you're just seeing osteoarthritis all day, you're like, shoot me, like what am I gonna do? Like there's nothing I can do. Just give NSAIDs to people and like maybe do a cortisone injection here and there. So I feel like you need to have a good mix, because if it's all sick patients, of course, then it's going to be also really challenging.
Right. And then the other thing you said, I think today, was you found, what did you say about rheumatology cases?
What did I say?
You said sometimes we tend to overtreat, or what was it that you said?
I don't know. I've just like
It
realized
was just like
that
a
I feel
thought
like,
that you had.
yeah, I just feel like the more I go to different practices maybe and see how other people do it, I feel like I was trained, the way I was trained, it was like very much a purist. Unless somebody fully meets diagnostic criteria for something, you don't really diagnose them, and you definitely are very hesitant in giving immunosuppression to someone. Like, I mean, the thing is, I trained in a county where like we saw really sick cases, and we never saw an OA or osteoarthritis or fibromyalgia unless it was they had lupus and that, right? And so we basically were very much like seeing really sick patients and giving them immunosuppressants, right? But then once I came into the community, and once I was I was kind of sort of like following that trend. And then I realized, one, I did realize sometimes diseases don't present like a textbook. But also I realized that there is, other rheumatologists who have a lower threshold of giving immunosuppression. Because in reality, rheumatology is gray. There's a lot of gray that falls into rheumatology. It just depends, I guess, how you're also going to practice, right?
Sure, your practice style that you choose to develop.
I'm kind of like trying to figure out like which, I think I'm trying to loosen up a little bit, and maybe, yeah, it's just
Be more
kind of
flexible,
like
you mean?
reflecting on it. I don't know, like sometimes I have noticed, as I have gotten talked to my friends and seen how other people practice, I'm like, well, maybe it is something. I just feel like every time I've also said, maybe it is this and maybe it isn't. And do you want to try something? Then you started, and then people, unless I have had people that I was like, I had a patient I followed for some time, and she had definitely hypermobile joints and fibromyalgia. And then she at some point was like, I'm getting a lot of stiffness in my hands. And I was like, well, maybe you have something inflammatory. And everything was negative. All her markers were negative. And I put her on methotrexate with a lot of hesitation, because it can be a toxic drug. And she was like, I feel so much better. And that's always amazing, right? Because then somebody's feeling so much better. But it's when somebody's like, well, I'm 20% better, but I'm also feeling side effects. So now let's go to another immunosuppressant. Now let's go to another immunosuppressant.
You jump around.
So, but I really like also that I come and get to read another doctor's notes, because I get to see how other people practice. And I trained in a fellowship where it was a small fellowship. So I didn't get to witness a lot of other people's style.
You shadowed someone a little bit, a friend of yours, before, right? You kind of went to her practice and...
Yeah, I have a friend my good friend in LA is a rheumatologist.
Shout out.
And so I always go, and like whenever I'm kind of like feel rusty, I always go and I'm like, oh, how are you doing it?
How was that? What do you think of that as an experience to kind of either prepare for this or as a way to kind of make you feel more comfortable?
No, I think it's always really nice, like going to her practice and just kind of like seeing that. Because I think a little bit of it is like riding a bicycle, right? It like always comes back to you because it's somewhere deep in you. Like you never forget, these things, but you always freshen up. Like, so then like when I'm at my friend's practice and then maybe she's offering a new drug to someone and I'm like, oh yeah, like I haven't used that one. Like, when do you use it? And then she's like, oh, I've used it here and here, or sometimes like, she'd be like, I don't know what this is. And I realized that I'm not the only person who would be like, stumped by this, right? Is that the right word? I don't know.
Yeah. So what about patient boundaries? How do you feel? Before we had talked about like when you go into a patient visit.
I'm just bad with patient boundaries.
You feel like it's still... So what are we talking about when we talk about patient boundaries?
Well, patient boundaries is like, yeah, I guess that's, you really want to define that, right? Because boundary has so many like meanings. It's essentially like some people are very like if you have a patient who is like, can you prescribe me this and prescribe me that and prescribe me this? And you're like, well, I'm not sure if you need this. And so there's like, some people are very kind of like, some doctors, especially men, I feel like are very like stern and very like, this is what I think and this is what you're getting. And that's kind of it. Like, I feel like they have like these strong boundaries. In general, because I've noticed people who, especially like doctors who are fast. Doctors who are fast, I think, in general, I'm not like saying everybody, right? Like I feel
you're
like
not generalizing.
I'm saying in general, but I'm not generalizing. I feel like the ones that I have observed, right, are not going to get into it so much. They're not going to like enmesh with the patient. They're not going to be like making eye contact for a long time because they know that the realities of the way we have to practice is like 20 minutes, 15 minutes as a primary care. Like, how are you going to sit there and be like, tell me really open-ended questions like we learned in medical school? You have to be like, okay, I have to click, 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 and address one problem and get out of here, right? That has never been my style. I'm not good at that style. And rheumatology is not even that. You have to hear everything. I've always felt like you have to hear everything. Now, my good friend always reminds me that you have the follow-up visit and you have to get to know the patient over time. And I'm trying to incorporate these things because I was really bad. I wanted to spend a long time hearing everything in case like putting so much together would give me, different diagnosis. And then I'm like addressing, like, I'm trying to address this and this and this and this, and I'm exhausted by the end of it, right? Because I'm basically seeing 5 patients in one patient. And so I guess boundaries is, I see like, my colleagues sometimes, they're able to say no, and the no that they're saying sometimes to the patient for certain things that are not super crucial. Like a patient's like, well, can you read this article of the newest thing and tell me, what you think of it? Well, reading that article really is going to take me an hour.
When the patient brings you the article.
Right. It's going to take me some time. And I only have like a couple of hours at night before, I have to go back to work the next day. And I want to also, just spend time with my partner, and I want to just like relax, and I have other things that I have to read, right? Like I have to read about the newest biologic and their side effects. And as much as I want to know what little research is happening with chronic fatigue syndrome, like I'm not going to be able to have time. That's the reality of these things. And I always feel like a bad doctor. I always feel like if I'm saying no to a patient, if they're leaving my office without feeling good and hopeful and like happy, then I am not a good doctor. That's like my biggest struggle. And I think that was a huge contributor to my burnout. Like, yes, the system is, system has problems. System definitely doesn't want you to be that kind of doctor, system wants you to be fast. But it's also my personality. It's also my thing that I need to be okay with patients not being happy with me. That's the reality of it. I need to just know by my conscience that I am doing the best that I can. I want to make sure that this patient doesn't get destruction of their joints, that there's not an autoimmune disease eating through their organs. And those have to be my objective. I'm not going to be able to make people completely pain-free. I'm not going to make the people's fatigue go away. I'm not going to figure out what they have, what everybody has. And those are things that I'm struggling with and I have to work on. And like being able to say no to people, or my hardest thing for me is I'm looking at a patient. First of all, most of the time I'm not going to be able to chart and just have the patient talk here. I have to ultimately sit and talk, like make some, eye-to-eye contact. And I think the hardest thing for me is seeing a patient be upset, feel, whatever, for whatever reason, not be happy, see it in their face and not have it give me like anxiety or, that's what I think when we say boundary, I guess, that's what, that kind of goes with it for me.
Yeah, the patient's reaction and how it's going to affect you. I think for me, boundaries boundaries in medicine, like practicing medicine, comes kind of from within me. Like, what is it I'm willing to do? What is it I'm not willing to do? And what consequence am I willing to deal with? Like, I feel like that's the way I define the boundary before I go in. And some days it's looser, some days it's tighter, some days I feel like I give more, some days I give less.
Right. Because that's true, because we're human, like I feel like sometimes I forget, and I think as a doctor, I have some image. I don't know where I've gotten this image of a doctor from, like some maybe movie that I had watched. It's like this noble person that is always kind of like very grounded and wise and can really control their emotions. And no matter what tantrum the patient throws, they can really stay grounded and do the right thing and always ultimately be kind. And then sometimes when I think about it, I'm like, damn, like I would love to meet that person, And we had an amazing family medicine doctor. I mean, but he had his own private practice.
When you were growing up?
Right. Well, yeah, when I moved to the US, when he has his own practice.
He still does?
I think so, yeah. I think he had and still has his own practice, private practice that takes insurance. But ultimately, so when you walk into his office, it says big sign, in this office, the wait time in the waiting area is average of 2 to 3 hours. Because he never interrupts you. He's always like, kind of like listening and trying to figure out what else he can do to help you. But I think he makes the bulk of his money from down the hall where he has a aesthetics practice, and he's a great diagnostician. He's a great doctor, but I think
you can only do it so much.
Like you're not going to be able to take insurance and spend an hour with someone and, be sort of like, okay, and what else you want? You also want some vitamin D? Sure. You also want some sleep medicine? Sure. And address everything. And you're probably going to see like 6 patients a day and you're going to get, $600 and then have to pay all of that to your medical assistant, probably.
Right.
Or to your staff and to your overhead and whatever,
So overall, what do you think? As both a locum experience so far, but also I'm actually kind of very curious myself about, as you know, like I'm pretty much out of the insurance game of medicine. Like I don't want to have anything to do with insurance. I have my feelings about it. I think it's very good. I'm very glad it's there. I think we need it still there. But what are your thoughts of like kind of being in this system, maybe continuing this way? Can you see yourself?
I have now realized that I feel like every organization kind of like, or every like medical group kind of does it a little differently. Depending on some sort of maybe like how they've set it up, whether it's nonprofit, whether they have negotiated what with which medical, and so the hardest thing would be to see 24 actually 24 is nothing for most rheumatologists who have their own private practice. They see like 30, 40, even 50 in one day, right? I don't know how. I don't see, maybe a PA that you've trained so well, who's like seeing most of the patients together, you see 50 patients, but I am not able to like do that. Like I don't know how to work that system. So I think for me right now, this place, at least 3 weeks into it, a month into it, right? Seems okay. Seems like those 4 days I have to be like just on and work hard the whole day. But the people are really nice. I have worked in other medical organizations where like they were not as supportive. Like this is just all like rheumatologists, and so I think that also really helps. We're just like
the department is all rheumatology. Do you guys run cases by? Do you go to people to run cases by them?
There are people.
Do you go to run cases by them?
Yeah, if I haven't a lot. I haven't.
But you feel like you can.
Yeah, I think, everybody looks busy, and so I'm not running, if it was like my best friend sitting behind me, who is a rheumatologist, would probably run cases with her all the time. But, yeah, like we also have teams, and so you can like ask questions. So I'll ask a lot of questions, especially like if it's like about insurance or about like how do I order this or how do I do this? I can just ask questions. I have support with that. The MAs are great, So in comparison, this has been definitely one of the better situations. And then of course, Bend has been great.
What else would you like to say to the lovely audience of digital nomad physicians? Because you're now legit.
I'm not digital.
You're a nomad. You're a nomad.
But I'm not digital.
You're not digital yet. No. Unless you're going to do some telemedicine there.
Yeah. What would I say to the digital? Like, I guess like for me, doing digital nomad was a little hard because I don't like going to a city. Well, no, actually that's not true. I wasn't fully digital even. Right.
You were in Portland.
I was
doing
a little bit of telemedicine, but I also think that I would go to our situation was we were living in Spain, and I was like, I can't really integrate here if I'm doing digital, right?
Right.
So for me, that wasn't as nice. For you, you have been digital nomad for a long time, and yet you integrate really well. And so,
I think the biggest factor for you has always been if you're going to go to a place, you want to be within the society. You want to be amongst the people who are working, doing what they're doing. You want to connect with the locals. You want to find local friends who are doing what you're doing, as in like they're engaged in what you're doing. So I feel like if you're not engaging in some sort of like job activity, it's not as easy for you to feel connected.
Yeah, that's the thing, is that feeling.
Right.
It's also a person. It's like for me to feel like belonging or connected, I need that. Whereas I feel like you can go and like say hi to the coffee shop person, to the barista every day, go sit there, do your work, go to the rock climbing gym, and maybe like even just not even make that many friends, at least initially, but you still feel okay. You still feel your sense of connection and belonging doesn't come necessarily from that. And so it's just like, I think we're different in that sense.
Yeah, and you also considered doing telemedicine rheumatology, but you gave that up because it was a really weird, odd.
Well, one, the pay wasn't that good.
Yeah, that's
right.
true.
Two, I was just not finding the idea of sitting. Like, I feel like if you're going somewhere where you really want to go into this like exotic remote place, right? And you still want to make some US dollars, then for sure, there's actually nowadays so many positions out there. But I was like, we were going to be in Long Beach, right? At that time where I was considering it. And I was like, the idea of sitting in, we don't have this big house with an amazing desk where I can set up everything and like make it perfect. And I was like, I just don't want to sit here and that was another thing. Maybe I haven't done it. Maybe if I do telemedicine, rheumatology, maybe it'll be good. But the idea of it wasn't that appealing to me, And then that's another thing, is the company that a friend of mine told me about was like, you basically have to sign a year contract. And I was like, I don't know if I want to do a year of this. Locum is nice because you can just do it for like 3 months, 4 months. You could just be done with it. And so, yeah.
I was pretty impressed that we couldn't find any jobs in Southern California.
Well, there were per diem
I sent
jobs.
you a bunch of places.
There was per diem jobs, but they were far, and I didn't want to drive an hour and a half.
No, it wasn't in Southern California. It was like, was that Southern California?
Yeah. There was like, from our place, Long Beach, I would go to like Riverside or Lancaster or like,
Is Riverside Southern California?
What do you mean? Of course.
Riverside?
Yeah, Riverside is like in greater, well, it's not LA County, I think, but it's
Yeah. All right. We'll call it Southern California. We'll call it Southern California.
No, there was definitely jobs.
Yeah, the commute in LA would be ridiculous.
Yeah, the commute was long, and I was like, Ventura. There were positions available.
So given all this that you've done, all these experiences that you've had, you still don't really see yourself maybe having your own virtual practice. You couldn't see yourself as a rheumatologist doing this virtually. We talked about this a little bit today.
I think,
as you chewed me out for having a medical practice that hasn't yet started in Long Beach and sinking tons of money into it.
If you're going to bring that up, you have to bring the whole...
No. That's not.
I didn't chew you out.
It's too raw for me to bring it up.
No, I think that I definitely think I have more of my visions of things are definitely more on the negative side than yours. You can definitely see like the positives of things, and I think that you're actually not like overly optimistic. You're realistic. I realize that. But for me, like seeing myself as a virtual rheumatologist, more negatives come up
Okay.
for me. Like, oh, what kind of people am I going to see? Like, I'm not good at this, like not giving too much. Is it going to be too much? Like a lot of things that come up that I don't know. But if this locum wasn't good, like I had really thought about it. I was like, I need to figure this out, and doing it virtually wouldn't be a bad idea. But I still think like I love Ayurvedic medicine. So far, it's really helped me. And if I was going to do some sort of a
ongoing education. If you were going to do it, you would do Ayurvedic education.
Right. Like if I was going to do something not mainstream rheumatology, I want to bring Ayurveda into it.
But you did do integrative. She's an integrative medicine doctor. Mm-hmm. But
I don't feel comfortable right now. I haven't, kept up with all the integrative. I would probably just have to subscribe to like all the, database and like, kind of like, I think because integrative medicine
I think what I remember when you told me is that you never felt like you could apply it to your patients.
It was like
actually
this huge amount of information that I learned for 2 years fellowship that I did. And I don't think I ever really learned how to fully like apply that to the patients, right? And so I think it takes practice. You just have to experiment and kind of learn.
You have to force it into your practice until it sticks.
And then also I think a lot of integrative is also just kind of finding a team. Like you want to find your team of the acupuncturist and these kind of things, and then just kind of like
medicine.
Refer. I was in like a underserved setting, so I couldn't really incorporate it and practice it.
And Ayurvedic, you could see yourself maybe incorporating some of that for
I
rheumatology
feel like if
patients.
I learn Ayurveda, it's like if I were to learn acupuncture and I would do it, right? Then I fully am an expert in that. Right now, I know about Ayurveda, right?
But you were an expert technically in integrative medicine because you finished it.
But being an expert in integrative medicine is just knowing what else. It's like,
I see.
Do you know what I'm saying? It's not like you're.
I got you. Integrative medicine is more like once you become that integrative medicine doctor, you still have to find all these other resources to bring in versus Ayurvedic medicine where it's all the skills you have to give.
Integrative medicine doctors focus on different things. You can go get an integrative medicine consult where like they will look into like you have high blood pressure and prostate cancer. Okay, I will pull up all the data. What are some things you can try? I could give you a full comprehensive integrative consult. Or you're my patient, I'm seeing you regularly, and then these are some things that I would recommend to you once in a while through this, practice that I'm doing. And then some people will focus more on diet. Some people will focus more on herbs, but each of these you're going to want to kind of go more in depth into.
Yeah.
Or you're just kind of like referring patients to these different. I could easily refer a patient to Ayurveda and have enough knowledge to say, these are some of the things that it's important. Like, I feel like you're somebody who probably Ayurveda would help, but I'm not an Ayurvedic practitioner. I can't look at somebody's tongue and say, your gut is inflamed or whatever.
With that said, the fire's out. Would you like anybody to follow you on your channels, on your handles?
I don't have a channel.
What about your website?
I don't have a website.
Your Instagram?
I don't have one. He's saying that I have to get on.
She does. Everybody does. Every physician should. Every physician, I think, should be speaking out about their experience in medicine. And I think we are, as physicians, I don't think we are comfortable kind of collabing as a lot of other people do, collaborating.
I write a blog very infrequently.
I was going to say if you were going to bring that up, but...
thisbeinghuman.blog, which is very personal and very like all about like this experience that I said about that day where I was like, okay, you have to accept the worst. Let's say that. That's the kind of stuff that I write about. It's not so much about medicine. It's about just, like mental suffering and how when I have like moments of getting out of it.
I think it's a great blog. And I think for coming from a physician, it's very good. And I think you're a great writer. I'm a great writer, I know that. So I can recognize another great writer. So guys, go to digitalnomadphysician.com, leave some comments. Would love to hear some engagement. Maybe I'll put this out on a podcast also, like you said, like you suggested, and I'll send it to the 13 people who follow me on my podcast.